Okay, so we go for the second classification of anemia, which is the morphological classification. And as I have mentioned before, it is based on the RBC morphology, uh, basically based on the size of the RBCs. So the morphology definition of morphology is a particular form, shape, or structure. And so how do we determine RBC morphology? So there are two ways that we can determine the RBC morphology. One is through full blood count, in which full blood count is a quantitative evaluation of the blood cells, and the peripheral blood film or smear, which is a qualitative evaluation of the blood cells. So one is to see the numbers, and the second one is to see the quality. So for the morphological classification just now, the common indices that we use in full blood count, number one is MCV, which means mean corpuscular volume, or it gives an idea of the size of the RBCs. The second one is MCH, meaning mean corpuscular hemoglobin, which illustrate the average mass of HB per RBC in a sample of blood, and it give idea of the color of the RBC. So this MCV and MCH are the two common RBCs indices that we use. So anemia classification based on the MCV is either we can divided them into the microcytic, normochromic, normocytic, or macrocytic. So cytic means size. On top of that, we also can put in the color of it. Chromic mean color. So at the end of the day, we can have classification of microcytic and hypochromic red cells, normocytic and normochromic red cells. Normo means normal, or macrocytic, which is means macro means large. Yeah, so the morphological classification of anemia is based on MCV, and when it is normal is around 80 to 100 femtoliter of the MCV, so that is normocytic red blood cells. So when the MCV is less than 80 femtoliter, we call it microcytic red blood cell. And when the MCV is more than 100, we call it macrocytic red blood cells. So you all can see from the diagram here, the normal is the normal color, normocytic. Macrocytic is the smallest size. And the macrocytic, they have the large size. And hypochromic mean the red cells becoming pale, less color. Okay. So the morphological classification is based on the size, either is big, normal, or small, and the color. Okay, so it has that spectrum. So what are the category, or what are the common causes of morphological classification? So for microcytic red blood cells in which MCV less than 80 femtoliter just now, the common causes are anemia of chronic inflammation, thalassemia, and sideroblastic anemia. So the first three is actually very common. So when you encounter a patient with microcytic red cells, so you need to think about iron deficiency, anemia of chronic inflammation or anemia of chronic disease, or thalassemia. So the macrocytic red cells can be caused by megaloblastic anemia, which is deficiency of B12 and folic acid, or it can be non-megaloblastic, which occur in patients with chronic liver disease, alcoholism, or aplastic anemia. For normocytic red blood cells, they can occur in patients with hemolytic anemia, spherocytosis, elliptocytosis, acanthocytosis, stomatocytosis. All these are one of the spectrum of causes in hemolytic anemia. And normocytic anemia also can happen in patients with bone marrow suppression. Something wrong in the bone marrow. Bone marrow has been suppressed. to produce normal amount of blood cells. So it can be due to antibody mediation, antibody mediated problem, infection, for example malaria, chemical or toxic agents such as drugs, toxin or burns, or mechanical problem which is cardiac valve prosthesis. So what are other RBC indices that we use? The first one is MHCH, which means mean corpuscular hemoglobin concentration, which indicate the amount of HB per unit volume. So try to compare this with MCH, and this correlates with the HB content with the volume of the cells. RDW is also one of the important RBC indices, which means red cell distribution width. It is one of the red cell morphology index in which indicates variation of red blood cell sizes. So if you have a high RDW, it means that there are high variation of red blood cell sizes. So the term for this is anisocytosis. Okay, another one which is important is reticuloside count, which also known as reticuloside index or retic count. So if you can recall from erythropoiesis, so reticulocyte are the young RBCs, young RBC. It does not contain the nucleus, but it is a bit larger and the color is a bit purplish compared to the mature RBCs. So most of the time, reticulocyte count is very low in the peripheral circulation in normal situation, but in certain situation, reticulocyte count will be high or will be very low. So it is the indirect measurement of the bone marrow, especially erythropoiesis. So if you see a lot of reticulocyte count in the peripheral blood, you can say that the bone marrow is actively produce all the red blood cells. Because of the demand is so high, so they will be releasing the young red blood cells to the circulation, hence a lot of reticulocytes being released to the peripheral blood. So what you know so far? Take a piece of paper and ask this question to yourself. List the causes of hypochromic microcytic anemia. You can pause this video and try to recall whatever that you have learned before. And which parameter indicating the size and color of the RBCs? So your homework is to make your own diagram of classification of anemia and list the unit used in RBC parameters, which are HB, MCV, MCH, MCHC, RDW, and retic count. We will discuss this during the class. So the summary is anemia is the reduction of HB, hematocrit, or RBC count, and it can be classified based on the etiology or the morphology classification. And the common RBC parameters used in classification of anemia is MCV and MCH. So thank you. I will see you in class.